My name is Karen Riley. I'm with Mississippi University for Women. Today we will discuss a patient with skin cancer and a care plan for that patient. The top 10 problems associated with a patient with skin cancer include impaired skin integrity, fluid volume deficit, acute pain, ineffective coping, activity intolerance, fear and anxiety, fatigue, knowledge deficit, impaired home maintenance, and compromised family coping. For this care plan, we're only going to include tonight the top 5 priorities. Beginning with impaired skin integrity related to cutaneous lesions as evidenced by disruption of epidermal and dermal tissues. The desired patient outcome include the patient will regain skin integrity to the skin surface. The patient will report any pain or altered sensation. The patient will demonstrate understanding of the plan to heal the skin and prevent further breakdown. And the patient will describe measures to protect and heal the skin and to care for any lesions that are already present. Nursing interventions include the nurse will assess the site of skin impairment and identify the proper nursing interventions. The nurse will classify superficial pressure ulcers by stage. The nurse will monitor the site at least once a day, noting any changes in skin color, redness, warmth, swelling, or pain. The nurse will monitor skincare practices and individualize the plan accordingly. The nurse will monitor the patient's continence status and minimize any exposure of that site to moisture. The nurse will assess immobility-related risk factors. The nurse will ensure that the client remains positioned off of the site. The nurse will evaluate any use of specialty equipment. This includes beds, mattresses, and any other devices. The nurse will implement a written treatment plan, including all prescribed topical treatments. The nurse will assess for nutritional status. For home care interventions, the nurse will instruct and assess both the client and the caregiver to remove or control any impediments to wound healing. The nurse will initiate a consultation with the wound care specialist as soon as possible. The nurse will teach skin and wound assessment, monitoring for signs and symptoms of infection, complications, and healing. The nurse will teach proper use of prescribed treatment. The nurse will educate them on the importance of repositioning every 2 hours, and also the correct use of any pillows, wedges, and other pressure-reducing devices. For fluid volume deficit related to osmotic diuresis as evidenced by decreased skin turgor and dry mucous membranes. The desired patient outcomes include the patient will show signs and symptoms of adequate hydration as evidenced by stable vital signs, palpable peripheral pulses, good capillary refill, good skin turgor, proper urine output, and normal electrolyte levels. Nursing interventions will include the nurse will monitor for any factors evident of deficient fluid volume. The nurse will watch for early signs and symptoms of hypovolemia, monitor intake and output every 8 hours, monitor vital signs every 4 hours, check daily weights, check orthostatic blood pressure, provide oral hygiene at least twice a day, provide fluids and diet prescribed, institute measures to rest the bowel when vomiting or diarrhea are present, hydrate with IV solutions as ordered, administer antidiarrheals and antiemetics as ordered, maintain patent IV access, with the appropriate flow rate and promote skin integrity. For home care interventions, the nurse will determine if it is appropriate to intervene in the deficient fluid volume of a terminally ill patient, or to allow to die comfortably. The nurse should teach the family how to monitor intake and output. The nurse should educate the family to weigh daily on the same scales, teach complications of fluid volume deficit and when to notify the physician, educate the client and caregiver on signs and symptoms of hypovolemic shock. The nurse should also teach the client and caregiver how to measure appropriately intake and output, and measures to treat hypovolemia and fluid volume loss. For acute pain related to the disease process, desired patient outcomes include: the patient will report pain and determine comfort and functional goals. The patient will perform activities of daily living with reported acceptable level of pain. The patient will obtain sufficient rest, and the patient will use methods of non-pharmacologic pain control. Nursing interventions include: the nurse will assess for signs and symptoms of pain, provide relief as needed, monitor for unrelieved pain, and administer medications as needed and ordered. The nurse will discuss any fears of untreated pain, overdose, or addiction with the patient. The nurse will demonstrate methods of pain control, such as behavior modification, relaxation techniques. The nurse will plan activities around periods of maximum comfort, if possible. The nurse will monitor appetite, bowel elimination, and ability to rest and sleep. Home care interventions include assessing the knowledge of and teaching the disease process to both the client and the patient. The nurse will develop a medication profile, and this would include any prescribed and over-the-counter medications. The nurse will assess the client and the family on their knowledge of side effects and safety precautions associated with pain medications. The nurse will provide written materials on pain control. A good one is a pamphlet from the Agency for Healthcare Policy and Research. The nurse will also reinforce a schedule for pain medication, and this will help to better control their pain. Ineffective coping is the next diagnosis, and this is related to a new disease process of skin cancer. The desired patient outcome include: the patient will verbalize his or her ability to cope with and ask for help. The patient will verbalize their ability to solve problems and participate in their usual level of society. The patient will remain free of any destructive behavior to self or others. The patient will communicate their needs to others. And the patient will discuss any recent stressors that may have caused this change in coping. For nursing interventions, the nurse will observe personal skills and knowledge and cause of ineffective coping. The nurse will observe strengths and recognize source of stressors. The nurse will monitor a risk of harming self and others. The nurse will use empathetic communication and encourage the patient. The nurse will allow the client and family to verbalize any fears, express emotions, and set goals. The nurse will use active listening and acceptance to help express emotions. The nurse will avoid any false reassurance. For home care interventions, the nurse will observe coping behavior and the patterns included and guide interventions accordingly. The nurse will refer to mental health care, social services, home nursing, and support groups. For client and family teaching, the nurse will enable the patient to problem solve, introduce relaxation techniques, develop appropriate educational tools to address coping strategies, and any other available communication resources. For activity intolerance, related to generalized weakness, secondary to the disease process, the desired patient outcomes include the patient will participate in activities with appropriate vital signs. The patient will verbalize any adverse effects of exercise and report onset of symptoms immediately. The patient will verbalize need to gradually increase activity based on testing, symptoms, and orders. The patient will demonstrate an increased level of tolerated activity. Nursing interventions for this patient include the nurse will observe for pain before activity. The nurse will determine cause of intolerance. The nurse will assess daily for appropriateness of the activities. The nurse will perform range of motion exercises if the patient is unable to perform the exercises. The nurse will instruct the patient to stop the activities immediately and report to the physician if any adverse effects occur. The nurse will allow rest both before and after the activity. The nurse will give emotional support and encouragement to the patient. The nurse will obtain the needed assistive devices before ambulation. The nurse will use a walking belt if the patient is unsteady. The nurse will monitor goals and set goals to increase activity. For home care interventions, the nurse will assess the home environment for factors that may lead to decreased activity tolerance. The nurse will teach both the client and family methods for setting goals for activities. The nurse will provide resources such as senior centers, exercise classes, education and recreational programs, and other things of that nature. The nurse will demonstrate the importance of sexual activity as part of daily living and use of acceptable techniques to tolerate activity. The nurse will also refer to social services as needed to help both the patient and family adjust to the patterns of daily living changes. The nurse will assess the need for long-term support groups and refer if needed. The nurse will also provide comfort and dignity to the terminally ill. That's one of the most important. For patient and family teaching, The nurse will educate on the importance of proper nutrition, signs and symptoms of activity intolerance, and give them a rationale for advancing activity. I hope this has been a big help to y'all. Thank y'all for listening to me today.